Hi, I'm Heather Wallace from the Central Nursing Education Department, and I am the Nurse Residency Coordinator. And I'm going to be talking to you about how to apply what you learned in the preceptor class to precepting with a nurse resident. So it is a little bit different, a little bit longer. And so we'll go through application of the knowledge that you already have, and then some of the other tools that you have specifically for the nurse residency. So following this presentation, you're going to be able to apply what you've already learned to the nurse resident, integrate your clinical skills into bolstering those skills or validating those skills of the nurse resident who may be doing these things for the very first time. We'll talk about formulating an individual orientation plan because every resident is not created equal. They're different generations. They may be a second degree. They may have been a CNA for a very long time. So their progression is going to be a little bit different depending on their background. And then we'll talk about communication skills and how to give some of that feedback. And the last thing we're going to do is talk about validating their competency. So it's a little bit different than when you have an experienced nurse who comes in with all of this skill and having done things. And now you've got a nurse resident who may be doing things for the very first time. So the first year of a new grad's life is called their transition to practice phase. So it takes up to a full year, sometimes 2 years, for them to really get to that competent level. That's why they say, for instance, certification, that you should have 2 years experience prior to getting certified in a specialty, because you're really not a content expert and very knowledgeable about that realm of nursing. So a nurse residency program is there to help transition them through that first year. And so the first piece of that is a preceptorship with you on the unit. And then their success is largely dependent on the coaching that they receive from you, how you socialize them to the unit, how you welcome them into the fold, validate their skills, show them how to communicate with the greater team. So one of the things that you learned in preceptor class was what competency meant. So it's the knowledge, and some of that they're coming with. So they have the basic knowledge, they've passed NCLEX, but they may not have the critical thinking and the application of it, how to make those decisions. Then there's the skill. So they have some basic skills, usually in simulation lab. They may have done one IV start on a live patient. And then the attitude. So they're coming eager to learn. So that part we have going for us as opposed to an experienced nurse. So you need to continue to foster that. Remember, you are growing a coworker. So just another quick review. In the preceptor class, you learned about the novice to expert continuum. So they're coming in as a novice. They have little to no professional experience. They only have what they were exposed to in clinicals. And then you're trying to get them to that first step, that beginner, advanced beginner, so that they're safe practitioners, that they can take care of a patient load by themselves, and they know their resources if they get stuck. So in that beginner phase, that novice phase, they're coming to you and they're very task focused. They'll actually still be pretty task focused when they get off of orientation. But they're coming to you with the general rules that they learned in school. They're very black and white. They may ask things like, that's not the way I learned it in school, and that's okay. Think about, they have learned the textbook way to do things. You're going to teach them your organization's way to do things, as well as some tips and tricks that you've learned along the way to make their day a little bit easier. But remember, you're always going to use those evidence-based practices that we have in Elsevier skills. That's what you're validating them against. So when you've done your fabulous job of precepting this bright and shiny nurse resident, they will be ready to move on to independence, and they'll be in stage 2 as an advanced beginner. So now they are a graduate nurse. They're at the end of orientation. They've demonstrated acceptable performance. They are safe practitioners, and you're ready to now be a peer. Your role is going to change a little bit. It's not over, but now you're moving to that coworker, peer, support person. You may end up being a long-term mentor. And so you're still going to be available to them because they're still going to have lots of questions. But now you're not married to them anymore. You're not with them the whole shift. You've done your job. So once they've moved from that initial first shock phase, they were all excited, and then they started to adjust. They went through that provisional adjustment. They were in the honeymoon phase where they think everything is great and every day is exciting. And then right as they're getting off orientation, see how that curve starts to dip? And now they've got uncertainty, they're losing their confidence, and they're out on their own. So hopefully this is where you're still reaching out and checking in on them, making sure that they're still okay, that you're there as a resource and a support, and you know that they can continue to do the great job you trained them for. But you see how low that gets. In like month 6, we lose a lot of residents at that point. So we really need to pay attention to them in the continuum. Your role doesn't stop at that 12 or 16 weeks. So I'm going to show you in Elsevier Skills how to look up a skill that you're not familiar with and how to grade a checklist. So you go to Skills, and first we're going to view a skill. We are going to look up chest tubes. And when I look it up, there's lots and lots of options. So we're just going to do a closed drainage system. And then once I pull up the actual skill, you can see I have lots of options here as well. So the quick sheet is a quick, down and dirty information that you need. The extended text has all of that same information, plus now it has the references and more detailed information. It's kind of everything all in one page. There's the supply list. So these are the supplies you would need to care for or insert a drainage tube. A chest tube drainage, assist the physician with that. There's demonstrations, and the video is not going to play on my screen, but on your work computers it will. So there's information about the chest tube drainage system, how it works, insertion, and then the lung sounds that you're going to hear when a patient has a chest tube. So it's really cool to look at this. There's illustrations where these are just pictures. So there's the good old-fashioned 3-bottle system, and then how that equates with what we have now. There is a post-test, and so as you know, some of the skills assigned to all orientees include a test. So it's usually they have to take the test or you're going to validate them. And then here's how you validate them. This is the skills checklist. So this is what you're saying they have met all of this criteria in order to be proficient and safe. You don't have to print this out and turn it in. You can print it out and take it into the room with you if you wish, but it's not necessary. You're actually going to grade them in the computer. And then there's related information. So this is all the other things that might be related to that topic you're looking at. So if we go back to skills and grade a checklist, now we're actually going to grade the skill that we just watched. We've gone in the room, we've done it with the resident, they have shown proficiency, and now we're going to grade them and show the skill that they have. So I'm going to say I want to look up by the learner. I'm just looking up somebody who happens to be on orientation right now so that you can see their list. And so these are all the things that this orientee has to be validated on by you, the preceptor. So you can see that there's a couple of them checked off by me. These are the ones that we did in nursing orientation. So you would, when you're ready, you would do the drop-down box, and pass means either they have done it proficiently, you've seen them do it, and they're safe, or they never had the opportunity to do it in orientation, because you're not going to see and do everything on this list. But you have talked through it, they know how to verbalize that they understand, and they know their resources. So you're still going to say pass, and then you're going to add a comment. Fail means they were not safe. Nothing on the orientation skills checklist needs to be left undone. Everything needs to be in the pass category for them to come off orientation. If it is a fail, they are unsafe, that needs to go to the manager and or educator immediately. In progress, we currently don't use in progress because it leaves it hanging out, and nobody's going to go back into the skills list after you, the preceptor, have finished your part to complete these. So in progress, we don't currently use. However, we will start using it in October of 2019 with our nurse residents, where we are going to start doing some of the skills in simulation ahead of time prior to them reaching you on the floor. And at that time, they will, we will check them off in skills lab on some skills totally. We will totally pass them. And then other ones we will put in that in progress category. And that means that we validated them on a mannequin or in a simulated setting, but we still want you as the preceptor to go back in and validate them on a real person. All right, so you're going to read an article about the married state model of precepting. And what I really want you to take away from that is a new way of thinking. Most of us were oriented, especially if you were in the medical surgical areas, that you've got total care of one, I've got the rest of the assignment, call me if you need help. We are moving away from that model. Literature has shown us, the evidence has shown us that we really need to be with the nurse resident or married to them for the continuum of their orientation. And what that's going to do, it's going to allow for critical thinking. So if you're building up the orientee, the old-fashioned model, one patient at a time, often they're not to a full patient assignment till very close to the end. And then we get upset that their time management is not good. Well, they've never managed their time. They've never seen you manage your time. So they need to see that from day one, how you come in and start your day, how you get report, organize and prioritize your day, and how those priorities change throughout the shift based on what's thrown at you. Admissions, discharge, patients crashing, visitors coming in, the physicians rounding, and how do you adjust your day to keep up with everything? And so they'll build confidence as you move them forward with skills and some of the care. So they're going to do a percentage of the total care versus one patient, then two patients, then three patients. You're never going to put them in independent practice, which means you're always going to be there. Your roles are going to flip by the end. At the very beginning, you are the doer and they are the watcher. They are your shadow. Then you're going to eclipse each other so that by the end, they are the doer and you are the observer. You're validating and observing everything that they do. So you're socializing them to the unit, to your coworkers, to the interprofessional team. And so that's going to alleviate their fear and increase their confidence as you manage them up with your peers and with the patients and the team. In this module, you also have a handout that is given to the nurse residents as well as you guys. It's called the milestone pathway. And so that form was created so that all residents kind of follow the same path and trajectory through their orientation. Now it's mapped out by weeks, but your particular nurse resident may move faster or slower than what's indicated on the page. But what it does is it gives you goals, excuse me, each week that your resident will try to attain. So rather than on those weekly forms, you having to make up some goals for the next week, they're already provided for you. And what I would really like you to do, I want this to be a valuable tool. So please take notes on it. Let me know how you like it, if it makes sense, if there's things I'm missing. Make note of those and let me know along the way, or let your unit educator know. So to wrap up, I'm really thankful that you chose to be a preceptor for a nurse resident. I hope that you will be able to catch on to their excitement and their eagerness to learn and really bring them into the fold of your unit. You also have in your module some videos for you to watch, some the nurse resident handbook. And so there are sections on the preceptor's responsibility as well as the nurse resident, the manager, and the educator's responsibility. Please take a look at those so that you know what everybody's roles are and they're not muddled. So this last little exercise in this presentation is for you to reflect on what it was like when you were first getting into the nursing field. What was your experience like? So that you'll have that frame of reference when you begin your orientation of a nurse resident. Thank you.